Hello, everyone. My name is Katie Jones. I am a PGY3 family medicine resident. I'm here to talk to you all about our QI project, which is over the utilization of social determinants of health as a screening tool in primary care setting. Co-resident is Nana Ofori, who is also a PGY3 FM resident. Faculty advisors Glenda Tiller, and contributors are Casey Bledsoe and Heather Longshore. So a little bit of background on our project. Social determinants of health are broadly comprised of the influences that impact the health of populations. Examples of this, but are not limited to, safe housing, reliable transportation, access to nutritious foods, and physical health opportunities, as well as financial stability. So these factors play a major role in people's health, well-being, and overall quality of life. According to Healthy People 2030, just promoting healthy choices won't eliminate these and other health disparities. Instead, public health organizations like us as their PCP need to be more involved to take these into consideration. According to data observed by the CDC, social determinants of health have been shown to have a greater influence on health than either genetic factors or access to healthcare services, which in turn put people at a higher risk for poor health. So this is the second part of a project that was previously done. And in that project, they tried to create a screening tool just to pick up on these health disparities and see if in the future these could be isolated and assistance could be provided. So in this part of our project, we were able to take that screening tool and look at specific social determinants. And in this case, we look at housing insecurity, food insecurity, transportation difficulties, and financial insecurities. And we're comparing 2022 from when this was initially started to 2024, which is the most recent data. So the primary aim of this project was to compare the percentage of our patient population that was affected by each social determinant and see if there were changes after intervention. So the methods that we used, patients were provided with the paper screening tool, which was then entered into the EMR for the specific social determinants that were mentioned earlier. When they were entered, then they would be categorized into low, medium, or high risk, which would then flag green, yellow, or red in our EMR. When we could see this, we were able to bring this up with our patients and ask if they would like assistance in these departments. If they were agreeable, then we would submit a referral to our health access network, which is our social workers, and have that department reach out to them to provide resources. If they declined or did not want to discuss it further, we would still provide resources in their after visit summary when they would check out, so that if they wanted to have these resources at a later time, then they would be able to access that. This data was collected from our OSU Healthcare Center as well as our OSU Eastgate patients. And then we were able to pull that data and put it into these charts just to see if there were any changes, improvements, and what specific areas seemed to have the highest difficulties. So when you look here at our data, we looked at the total screen patients of 2022 and 2024. So overall, the 2022 is here in orange, and then 24 is in the salmon color. We have more patients that were screened overall, and less patients, about 1%, that are declining. And if you look over here at the amount of patients that were referred, we see less patients referred overall, but we are thinking that that is related to the fact that many people have been previously referred, and we're not needing to utilize them quite as much as we did in the beginning. If we look at housing insecurity, there is a decrease overall in patients who felt like they had no steady place to live or that couldn't afford their mortgage. When you look at food insecurity, you can see that there was a decrease in those who felt like they ran out of food often, and no change in those who felt that their food didn't last. Transportation difficulties also decreased in those who felt like it was difficult to make it to work, and those who had trouble getting to medical appointments and picking up their prescriptions, etc. And financial insecurity, if you look down here, those who felt that it was not difficult at all, or those who felt it was not very hard, there was an increase in that number, so that's good. You had more people feeling that it wasn't difficult to pay for things financially. Those in the somewhat category right next to it showed a 3% decrease, a 2% decrease in those who felt that it was hard to pay their for finances, and then a 3% decrease in those who felt that it was very hard. So overall, it's reasonable to infer that these interventions of referrals to case management and providing resources had a positive impact on the social determinants of our patients, and that this can continue to have a positive impact in our patient population and hopefully could be utilized, statewide or nationwide to help make this more known and easier to provide resources for our patients. So this project will continue to evolve. We're planning to create a third step in this to where we can look at the HON department, our health access network, and see if these patients are responsive to the referrals, how many people are actually utilizing it, what resources were useful, and we'll continue to grow in this project. We would like to add in pediatric patients hopefully in the future because they are not currently included in our project. Now, some things that could make this a little bit more difficult is that sometimes with the data, it's hard to tease out if these numbers included patients that were previously referred or previously high in certain areas. And just making sure that we're keeping up with these screenings yearly or routinely so that we can get the most accurate results. So overall, we're very happy with this and we continue to like to keep an eye on things and see how they improve. And we would like to thank the hardworking staff of the Health Access Network who gave us strong support for this project. We also want to thank the OSU Family Medicine residents, PSRs, nurses. Without their participation, this would not have been possible. And this concludes my presentation. If you guys have any questions, I'd love to hear them. Thank you guys.